My name is Gareth Williams and I'm a specialist orthodontist working in the southeast. This is a short video to help you qualify under the NHS for braces at your first appointment. So for you to qualify under the NHS for braces, you need three things. One, teeth that are crooked enough to meet our criteria. There's not a lot you can do about that. Two, a desire for tooth straightening, so we can't force you to have your teeth straightened if you don't want them straightened. And three, and most importantly, an excellent level of brushing and gum health. It's the third one I'm going to talk you through today because the other two are things that we can't really control. Substandard brushing or poor gum health is the most common reason that patients are turned away at their orthodontic appointment and not allowed to progress with treatment. So hopefully this video will increase your chances of getting in if you want your teeth straightened. It's simple really, all you have to do is brush twice a day with a toothpaste and a toothbrush while looking at what you're doing in the mirror. We consider your teeth to be clean when you've got none of that white creamy substance that we call plaque on your teeth. You can get rid of that creamy white substance by making sure that the brush makes contact with all of your teeth on all surfaces. So that's the outsides, the insides, and the biting surfaces of the top and bottom teeth. It is hard to see that creamy white substance, so you might find that disclosing tablets, which you can get from Boots, Superdrug, from the practice itself, from anywhere really, relatively cheaply, can help stain that plaque so you can see it to remove it. We don't mind at all if patients have used those tablets just before coming in and then your tongue is all stained pink. That's actually a good sign that you're putting in the effort. So our heart breaks for that sort of thing. The most commonly missed areas are around the gum line and between the teeth. And one of the reasons for this is people don't notice when they just sort of are mindlessly brushing, which is why you need to be focused when you brush. And the other reason is that it's uncomfortable to brush the gums, especially if you're not used to brushing them. And when gums bleed, people often panic and they think, oh, I've cut my gums. But actually the opposite is true. You're getting rid of infection that we call gum disease or gingivitis. So when you brush your gums, you'll find that you might get a little bit of blood. Don't let that put you off. That's a good sign. Most children brush either way too gently or not enough. The last thing, which is really important, is we need you to use interdental brushes between the teeth. Now, interdental brushes look like this. You can get them from, again, Boots, Superdrug, Amazon, anywhere like that, or from the practice itself. And make sure that it goes between the teeth by the gum line. Again, the first time you do this, it is uncomfortable, but once you get the hang of it, it's the most normal thing in the world. And it's actually a very good thing because it gets rid of bad breath, gum disease, and keeps your teeth very, very healthy. The first time you do it, expect the gums to bleed, especially if you've never done it before in your life. The reason orthodontists are so fussy about brushing is because of the risks that are associated with straightening teeth that aren't well brushed. There are two risks and they're very common, unfortunately. One of them is decay, squares of decay around the brace, which then last permanently, and unfortunately all orthodontists, including myself, have seen it countless times. The other downside is you can get permanently loose teeth at the end of treatment if your gums aren't kept nice and healthy. So the phrase in orthodontics is, you're better having crooked teeth than straight and healthy ones. Whereas the patients who brush well have amazing results. And if you want to see how amazing our results can be, check out my Instagram, which is Dr.WilliamsOrtho. Also, if you're not sure if you want your teeth straightened, if you don't know if it's the right option for you, look at Instagram as well, because it can give you an idea of similar cases and what people look like before and afterwards. If you do these things, that you'll find you virtually never have a bad taste in your mouth or bad breath. I've got links to other instructional videos in the description below. I've got links to the products in the description below. So I'd say just find out what you need to do, get what you need, get it sorted so that the first time we see you, we can give you all your options. Then remember, unless the teeth are clean and the gums are healthy, there is nothing we can do for you. Which is annoying because I'd love to help you. So do your best and see you soon.